8 heart attack warning signs 1 month before. Heart attacks are serious medical emergencies, but did you know that your body might be trying to warn you about them weeks before they happen? Let's explore the 8 warning signs you should never ignore. Number 1. Irregular heartbeat. Arrhythmia, especially ventricular fibrillation, can signify a heart attack. Heart rhythm problems are known as arrhythmias. They can cause skipped, additional, or irregular beats, which may be harmless or life-threatening. Ventricular fibrillation, trembling ventricles don't pump blood. This medical condition could induce cardiac arrest if not treated immediately. Ischemia, plaque in the coronary arteries cuts off heart muscle blood flow before a heart attack. Heart attacks can start with palpitations, dizziness, and fainting. These symptoms may indicate ischemia-related arrhythmias. If the heart muscle sustains damage, ischemia can trigger a heart attack. Untreated ventricular fibrillation after a heart attack might cause cardiac arrest and death. Although other symptoms or risk factors may accompany an irregular heartbeat, it may not indicate a heart attack. See a doctor for irregular heartbeats or other heart concerns. Number 2. Abdominal pain. Stomach pain may indicate cardiac problems, especially in women. Most heart attack symptoms are chest discomfort. However, women may have unusual symptoms. The abdomen, back, jaw, neck, and shoulders may be painful. These strange symptoms may appear weeks or months before a heart attack. Coronary artery disease reduces abdominal organ blood flow. Stomach pain might occur during activity or stress when the heart requires more oxygen-rich blood. Even though stomach pain alone may not indicate a heart attack, you should take any odd or persistent symptoms carefully, especially if you have other risk factors. If you have sudden or severe abdominal discomfort with chest pain, shortness of breath, or lightheadedness, seek medical attention to rule out a heart issue. Just a quick reminder. This video is for educational purposes only. If you have any medical concerns, please consult your doctor. Number 3. Chest pain. A month before a heart attack, chest pain may indicate a problem. Heart attacks usually cause chest pain. Pain may expand to the neck, jaw, shoulders, arms, and back. Patients with heart disease, due to reduced blood flow to the heart muscle, may experience angina, chest pain, or discomfort weeks or months before a heart attack. A large meal, physical activity, or emotional stress may cause this. Shortness of breath, nausea, lightheadedness, sweating, palpitations, and chest discomfort may precede or accompany a heart attack. Symptoms vary and may be absent. Smoking, high blood pressure, cholesterol, diabetes, obesity, and a family history of heart disease increase chest pain and heart attack risk. Extreme, chronic, or accompanying chest pain demands immediate medical intervention. Early therapy can reduce heart damage and improve results. Number 4. Fatigue. Fatigue can predict a heart attack a month ahead. Coronary artery disease can slow the heartbeat before a heart attack. Reduced cardiac output may prevent the heart from pumping enough oxygen-rich blood. Thus, even light exercise can tire people. Limited coronary arteries hinder heart muscle blood supply, producing ischemia. A lack of heart tissue oxygenation can produce fatigue and weakness. Fatigue may occur as the heart works harder to compensate for less blood. Unstable angina. Some people feel chest pain at rest or with light exercise before a heart attack. This may cause fatigue, shortness of breath, nausea, and sweating. Unstable angina can cause a heart attack. Chronic conditions, slowly developing heart failure due to cardiac muscle deterioration might cause weariness. Heart failure's insufficient blood pumping produces fatigue, weakness, and other symptoms. Risk factors: fatigue, high blood pressure, cholesterol, diabetes, obesity, and a sedentary lifestyle can increase heart attack risk. Lifestyle changes and medication can help reduce heart disease. Even though exhaustion alone might not indicate a heart attack, you should take unexpected or chronic fatigue seriously, particularly if you have other heart disease risk factors. Check for heart disease if you experience sudden or acute tiredness, especially with chest pain, shortness of breath, or nausea. Don't forget to hit the like button and subscribe to our channel so you never miss out on our new informative videos. Number 5. Insomnia. Heart attacks rarely cause sleeplessness. Sleeplessness, however, can indirectly impair heart health, particularly heart disease risk factors. Chronic sleep disturbances, especially insomnia, are associated with cardiovascular diseases, including heart attacks. Poor sleep can impact heart-healthy blood pressure, inflammation, and glucose metabolism. Medical or psychological issues may cause sleep disturbances and increase the risk of developing heart disease. Depression, anxiety, and sleep apnea all cause cardiovascular problems. Medications for insomnia can potentially harm the heart, as sleep aids or sedatives may impact the heart rhythm or blood pressure of sensitive individuals, increasing the risk of cardiac events. Warning signs. While insomnia might not necessarily signify a heart attack, evaluating other symptoms is important. Examples: chest pain, shortness of breath, fatigue, palpitations, and dizziness. If these symptoms or other heart disease risk factors accompany insomnia, check for cardiovascular issues. Number 6. Hair loss. Hair loss doesn't always indicate a heart attack. However, some research suggests an unclear link between hair loss and heart health. This link may be due to health issues or risk factors. There may also be a link between alopecia and hair loss. We must examine heredity, hormones, autoimmune illnesses, and drugs. Hormonal changes and autoimmune illnesses have the potential to increase heart disease risk. Hormonal imbalances, especially high androgen levels, can cause hair loss and heart disease. Women suffer from polycystic ovarian syndrome, while men experience hormonal imbalances. This can worsen hair loss and heart disease. Chronic stress, poor diet, and inflammation may indirectly cause hair loss and cardiac problems. Long-term stress can cause hormonal changes and inflammation, causing hair loss. Despite these associations, hair loss alone may not indicate a heart attack. If you're worried about your heart, watch for these indications and see a doctor. Number 7. Excessive perspiration. Anaphoresis, or profuse sweating, might signify a heart attack but usually occurs before or during. However, profuse sweating before a heart attack may indicate cardiac problems. Stress releases adrenaline, which activates the sympathetic nervous system. This activation raises the heart rate, blood pressure, and sweat. Beta blockers and diuretics can cause more sweating. Excessive sweating can signal a cardiac condition, along with chest pain, shortness of breath, nausea, lightheadedness, or arm, back, neck, or jaw pain. Number 8. Shortness of breath. Breathing problems can predict heart attacks a month in advance. This symptom typically occurs when ischemia reduces heart muscle blood supply. Ischemia is caused by coronary artery blockage that supplies the heart. Shortness of breath may indicate a heart attack. Narrow or obstructed coronary arteries reduce blood flow to the heart muscle. Without oxygen, the heart muscle suffers myocardial ischemia. Low oxygen makes the heart work harder to pump. The increased workload might cause dyspnea, especially after exercise or stress. Heart failure produces dyspnea. High blood pressure, heart attacks, and coronary artery disease can cause heart failure. Recognizing these warning signs and seeking medical help promptly can make all the difference in preventing a heart attack or minimizing its impact. Don't ignore what your body is trying to tell you. Thanks for watching. Don't forget to like, share, and subscribe for more health tips and information. Take care, and stay healthy.